Okay, guys. Hey, what's worse than getting old with old eyes? Basically, it's this: an Asian getting old with old eyes. Because hey, look, we've got small eyes to begin with, and as we age, we get more, I guess, smaller eyes, slantier eyes. That's the reality of the culture where we're in. So look, I'm closer towards 50 than I am 40. And look, I'm getting kind of old and saggy, and my eyes are kind of heavy. So, what are we going to do about things? Well, there's a couple of things I see and what I don't like. First of all, if you look over here when I smile, do I get lines at rest? No, I don't. That's because I've been Botox. So, do I look natural? Yeah. Do I have lines? No, I don't. So, hey, do I need to have any more Botox or any Botox there at all? The answer is no. What I need, or what I think I need, is basically this bit here. See this bit? It's excess skin over here, which is lax. So I've got some skin laxity in my lower eyelids. Every time I smile or do this, I've got some, yeah, skin laxity, which I can actually do without. The other thing which I don't like is over here, you can see I'm really, really heavy. And if I can have some kind of energy device to give me some collagen contraction on my upper eyelids up here, I can get a little bit more opening of my eyes up here, and make me feel or look less tired, really, and also open up my eyes. The other thing which would help as well is actually my brows. If you can see where my brows are sitting, if I can get them up just a tiny little bit up here, that can help as well. So when I look at the eye, I actually look at the eye complex, not just looking at the eye itself. I look at the skin surrounding the eye. So it's the crow's feet down here, the lower lid, the upper lid, together with the brow complex, and that's what I consider eye rejuvenation. So I think for me, what I need, brows a little bit higher, eyelid opening a little bit bigger, so you can see how it's hooded, and it's just not a good look. Skin a little bit tighter over here, and you can see I've got lost collagen over here. Every time I smile, you get that crinkle over there. Botox is not going to fix that. It's going to make that worse, actually. So need some collagen stimulation. And also sometimes if I can get someone who's good enough, this is what I normally do as well, is I can get someone to Botox me just here. Reason being is that when I smile, this is called a hypertrophic orbicularis oculi. So in other words, I've got muscles here which are really strong, which contributes to the eye bag as well. Part of the aging process is the loss of volume around here as well. In other words, loss of fat, and that gives me a tired look. So if I can get someone skilled enough, I do this, but I can't do this to myself. I do this 3-4 times a day to people, but not to myself. A little bit of filler over here in the tear trough area, just a tiny bit there, and that will help reduce the line which I have here as well. We only need, well, I only place about 0.1 mil of dermal filler, something like Volbella or Restylane around that area. So I think I need multiple treatments, and I'll show you how it's done step by step and the end results. Okay, so you can see my eyes now at rest, kind of heavy. When I smile, this is what I look like. Don't quite like it, and I'm going to do something about it. So stay tuned, and I'll show you the before and after. I illustrated my problems earlier on this day, and today we're going to get things rectified, as in my eyelids done, opened up, and we're going to use what's known as Ultherapy, or Ultherapy. So this is what I'm going to use. We're going to use several different kinds of transducers, and the transducers I'm going to use will be a 1.5 under my eyes, probably a 3 and a 4.5 on my forehead. And what I'm trying to achieve with this is basically opening of my eyes, decrease in my hooding, and basically collagen stimulation underneath my eyes. So we've got some baseline photos, you've got my baseline videos. Obviously I'm not going to do this myself, I can't do this myself. I have Adriana.
Hi.
Hey.
Hi.
Okay, so Adriana is, look, she's super cool, and she's one of, from what I understand, she's one of the best therapists there is in Australia. So I'm entrusting her with my eyes and eyelids, and we'll be doing this treatment very shortly. Okay, so hang tight. I'll show you how it's done, and I'll show you the before and after results. So stay tuned. Okay guys, so this is what we're going to be using. We're going to be using Ultherapy. Ultherapy basically is the newest generation of devices used to stimulate collagen. The beauty about this device compared to other devices is that it's ultrasound guided, and we're using what's known as HIFU, H-I-F-U, high intensity focus ultrasound. This is a newer generation device compared to something like Thermage, which I think is called first generation. Do I own a Thermage? Yes, I do. Do I want a Thermage on my face? Probably not. Why? Because I believe that Ultherapy, using a fourth generation device, is probably the best, yeah, I probably want the best for my face. So that's the reason why we're actually using this device. So this can be controlled. Adriana's doing the treatment. We have different transducers here, and the transducers are basically the diameter of the delivery system, and we can adjust everything in accordance both to the diameter but also the depth. Am I correct?
Mm-hmm,
yeah.
correct.
So we can actually use an ultrasound to actually see the depth, and we can dial it in exactly to the depth of which the energy device is delivered. So what we want to do is we want to stimulate collagen. So the way we do that is we want to actually denature collagen, and we want to heat up the dermal layer between 65 to 67 degrees Celsius. That way we break down the collagen and stimulate the fibroblasts, which should give me a contraction on my lids. So we'll see how it's done.
So we're just marking up where the brow sits. So marking off where the pupillary line is, putting some X's over where the frontalis sits, because we're not going to be treating on the forehead.
Okay guys, I'll talk you through this. From an aesthetic point of view, from a male, what we want to do is have the brow sit horizontal. So we can do a couple of things. We can use energy devices to help lift the brow. We can do brow lifts. We can even trim the brow, pluck the brow. So simple things like that. We can use fillers. We can use a lot of things to actually elevate the brow or make it sit in a position where aesthetically it's more pleasing. For me, I want some elevation because I have both brow ptosis, a slight brow ptosis, in other words, brows dropping down, and then also an eyelid ptosis, which I absolutely hate. So hopefully this will address both issues in the one treatment.
So I'm going to pop some gel on.
So basically, Adriana, the gels, you're using that as an ultrasound gel to see the depth. Am I correct with that?
To see the depth,
Yep.
we've got live visualization,
Cool, cool.
and that's what we need to conduct the treatment.
Cool. So the great thing about this, guys, is that we've got live visualization, so we can see how deep my between my skin and my muscle layer is.
Yep, so that green line there is the indication of the depth that we're treating, and everything above that point.
Cool. So you can see why this is an exact treatment compared to RF, which is basically hit and miss.
Okay. All right. So you ready there?
Yep.
Okay, count of 3. 1, 2, and 3. How did that feel?
Probably 0 out of 10.
Awesome.
1 out of 10. 2 out of 10 pain. 3 out of 10 pain.
Slightly accumulative.
Yeah, probably 2. Feels more warmth than anything else, and I can actually feel the lines as you're actually laying across the lines. I can actually feel it go across horizontally. Yeah, is there a frontalis nerve there over there somewhere? Temporal nerve?
The notch through here.
Yeah, that's a supraorbital
And then
nerve.
you've got your temporal through here.
Yep, temporal through there.
So that's where you've marked off.
Yep, so that's not where we're treating, so
No.
that's great. So look, realistically, 2 to 3 out of 10 when it comes to pain. A little bit stingier up on towards the end of the lines. Yeah, my brother, I can publicly announce this. My brother Ian Lim, who's the CEO of FJ Benjamin, had this treatment done, and he said it was the most painful thing ever. Younger brother's a wuss, so can't tolerate that. Older brother always wins. So, Ian, got you on this one. Live on YouTube, mate. So what transducer are you using? What size here, Adriana?
I'm using the 3mm.
Yep, what's the reason for that?
The reason for that is because of the shallow bone that we've got through there, so we can't go any deeper than that generally, but I am going to give it a go with a 4.5mm.
Okay. You think there's a difference between males and females when it comes to frontal bossing? Because for males we've got bone that's bossed before, in other words, more prominent bone.
Yes.
Yeah.
There tends to be a little bit more flesh and bone in the brow.
Yeah. For males or females?
For males,
yeah.
yes.
Yeah. So definitely for males, you can you can see frontal bossing is something which we have. We're more prominent with our orbital rim and crest, together with bossing of our skull. It's the difference between males and females, by the way. Nothing to do with the size of our brain or anything, but
It's right on bone. I can see it on the screen.
yep.
So after 3, 1, 2, 3.
Yeah, that's probably 5 out of 10. That's going on 6 out of 10,
So
pain-wise.
I'm just going to deliver a few here.
Yeah, it's getting there.
Okay.
Yep,
All
that's
right.
fine.
Perfect. So we're doing the other side.
Cool. Hey guys, so now it's been 3 months, after my oral therapy. I'm not holding my brows up nor my lids. This is what I look like now. Have I improved? I think I have. There's been approximately, if I were to measure it, about a 1mm elevation of my upper lid. So if you look at the before and after pics, I'm actually really happy. Look, it's a subtle improvement, but it's opened up my eyes. Yes, I do need treatment down here, ideally, but a simple treatment like oral therapy with 0 downtime can give pleasing results. So am I happy? Absolutely. I'll show you another pic of my mum. We did my mum at the same time on that day, as she's improved a lot. The more skin laxity you have, the better the results. So when we're doing oral therapy, it's very important. It's not only the device, it's also the operator. So it's operator dependent as well. So always choose a board certified derm or plastic surgeon to actually help with that treatment. Okay, so this is my mum. She's not an ideal candidate, but we thought we'll give it a go. Look at the heavy jowling and her features. So here we are performing oral therapy in the standardized manner. So I'm not exceeding the company guidelines with this. I'm just doing this as a demonstration. So you can see the before with heavy jowling and 3 months later. So look at this 3 months later. We've got a good improvement. She's extremely happy. And this is me in June of 2016. Look at my upper eyelids, both sides, and look at my eyelids now. This is September 2016. And we do a comparison side by side. You can see the marked improvement of my eye opening. Am I happy? Absolutely. All I need to do now is fix my eye bags and I'm happy. Hey guys, look, thanks very much for watching this rather long video. I try to do educational videos and I would love you to subscribe for more information. I post a video up every Saturday, Brisbane time in Australia. The other thing as well is that I am on Instagram, so I try to post maybe 2 or 3 videos a week. So if you're really bored and you want to learn something new, follow me on Instagram. Once again, thanks for watching this video and remember to subscribe for more information. Thanks, bye.